way they listen and watch human rights radio and television. For those of where they wonder why the ordinary president come back, that now because something very important to all of us now in day for ground. It gets some people when they say we beg, even though their schedules they tight. Can you tell them to stop this? Even though their schedules they very tight, we beg them. Even when they beg the leader of the team, as they beg, she said, "No, this is what we do. This is what we do. You don't need to beg us. We are ready to come. We are ready to educate the members of the public, most especially in this December month where we enter." Now that time you go see, say, boyfriend and girlfriend, they do this one, Christmas Eve, that one, this one. All these ones, una go hear so much things about HIV. This now people when be say, then they grounded when it comes to knowledge. Even me, as I did here now, as soon as I introduce the program, I go carry paper and pen. I go begin they take note. The way students they take note because this knowledge where they go give us no be here. In fact, one of these days, una go hear them inside the Brekete family program. Madam, good morning, Emma. The microphone they near you, dear man.
Good morning, sir.
The yellow one there with you, dear man.
Oh, thank you, sir. Thank you. Good morning, Berekete family. Good morning, Human Rights Radio listeners.
And viewers.
Oh, I didn't know we're on television.
We are on three television stations as we speak. We are on YouTube. We are on Facebook. We are on Twitter. We are on all the social media platforms, man.
Thank you so much, my ordinary president.
Yes, man.
Embelembe.
Oh, lo. What be your name, man?
My name be Christiana Ekaite Lanion.
Okay, which organization you they represent, man?
I dey work for one international organization called Family Health International. But now me be the leader of the Global Fund project for HIV in Nigeria, where we they provide prevention, treatment, care, and support services.
What about awareness, man?
Yes, prevention starts with awareness. So when we say prevention services, it means say we they do information, education, communication. We they help people understand the behaviors where they put them at risk, and then we they follow with things where it help them prevent getting HIV through physical materials. We go follow up with what we they call HIV testing. This HIV testing now be the window to getting all the other services, because once we don't work hard for the prevention part and we enter the testing, the purpose of the testing be say, make we know who gets this virus and make we link this person to treatment. And the one thing where it in my mind to talk today for here, be say, now for 1986, then first notice say this virus day.
1986?
Yes, and Nigeria, they denied that time, say the virus no day, the virus no day. But 1989, the first case was then discovered. And from that time on, Nigeria don't get different programs, say, make them take, comot HIV from our midst. Waiting make me dey happy, because for the last 30 years, now the work where they do be this. It be say Nigeria don't go from, say, we they deny, say the thing no day, to the fact that
reality don't set in.
Thank
say,
you.
We get them.
It they estimated say now around 1.9 million people get this virus. Waiting they make me happy be say we don't work, so they around 1.8 million people don't know say they get HIV. Not only say they know, then they for treatment.
Can they collect medicine?
We don't they give them medicine.
And they go live their normal life.
Yes, this work where the government of Nigeria do well so. Join with other partners, and I go mention the partners because different development organizations, like the United States government PEPFAR project, like the Global Fund for AIDS, TB, and Malaria grant, like other small foundations, United Nations organizations like UNICEF, UNAIDS, UNDP, then don't carry hand join for this matter, and then don't help government of Nigeria so that we reach our people and we don't get this success. Even globally, this make Nigeria they like country where get responsible, the way they're responsible for in people. But as I they talk so, my NACA DG, Dr. Gambo Aliyu, he talk one thing in this current World AIDS Day. He said we don't push this stone uphill. We don't come reach the crest of the hill.
We go wedge jam.
Not to wedge jam, carry and put on top, now it remain. So this World AIDS Day campaign, where we they do so, it be said to enlighten our people. Say this small effort of wedging the stone reach up, it go need make we do things differently. And I make, if you see the t-shirt where I wear, I don't know whether then they pick them up for the TV.
Then they pick them.
It say equalize to end AIDS.
Equalize to end AIDS.
So now wetin we want talk about today be say wetin be this equalize. Because if we understand wetin equalize be, all of us, including ordinary president, go follow join hand, do wetin we need to do to equalize.
Thank you very much. You see, my belief be say everybody suppose join hand for this matter, this fight against HIV and AIDS, because knowledge now be the most important thing where we need. When young children, young girls and boys understand, say, this sickness, even though, they kill again like before, but not be fashion it be. And the ones who don't get it and make them know, say, no be death sentence it be. I go like make I take permission from you, make I invite one young, vibrant, beautiful lady who will be one of your daughters. Make she come sit down here. Make you and her interact, because at her level, she go understand this language more than me, because you don't talk to the lowest people, the middle people, and the highest people. You not person when be say you they fit cut across all the levels and then blend with them. Harirat, come take over with your auntie.
Thank you so much.
Thank you, my ordinary president. And our people where they listen to us, we know say every 1st of December since 1998, international bodies don't set them as World AIDS Day. Meaning so that the day where we say we go, they celebrate people where they get AIDS. And our sister where they for studio, she don't talk within the day for. She don't tell us about it. She don't tell us about the organization. And also we know say stigma they attached to them. Many Nigerians, they get this thing, but they know if you come out talk, take off say if they talk and people go they fear to near them, people go we still get that stigma. And that is why for the team means say waiting they focus this year's on. And she don't tell us say now about equalizing them, like to make sure say everything they equal. So I go like make you continue, our auntie.
Thank you so much, Hajrat. I happy say
auntie, I beg put the mic
okay,
for your
thank
mouth
you.
so that we go here.
Hajrat, I thank you. And I happy say as ordinary president come out, now young person like you in bring. One of the things whenever they equal for this work where we they try to do to prevent HIV/AIDS and to stop it in our midst, it be say young people know they represented well. When we they talk about new infections, as new infections for HIV don't go down in the general population, and miss young people age 10 to 24, the new infection they rise. Meaning say, as the message don't plenty for HIV, so young people still never get all the things where they need to get, whether na information or whether na services, or we go make them prevent themselves from getting HIV.
Okay.
So one of the things where we want equalize be access to prevention, treatment, and care services for young people. That is one of the things we must equalize. Another thing where we want try to equalize, we say the prevention of mother to child transmission, it never reach where it's supposed to reach. Because many countries will get HIV problem, they don't reach where woman will get belle, no, they pass HIV to in Peking. Places like Rwanda, Botswana, Zimbabwe, they don't go far past us.
And
Why?
Sorry to cut you. And this one are even African countries like us.
Yes, I don't call Obodo Igbo countries because now from home we go start to solve the problem.
Yes.
Wetin dey happen for Nigeria be say mothers wey get belle, they no dey gree come out to facility come test for HIV because many of them no even dey come facility, and many of them no dey born for facility even when they don't know them HIV
Positive.
they HIV positive. So the problem be say even though we get wetin we fit do make positive woman give birth to negative babies, we still dey get plenty negative babies. And wetin dey even break our heart the most be say when we get these negative babies, the mothers no go bring them for treatment. So the death amongst these babies plenty. Moreover, the generation we go continue to get HIV still go dey grow. And we want maybe in the next 5 to 10 years, make we get, no say for at least the next 2 or 3 generations, nobody go get HIV. So now it make us, for this year, we dey talk about equalizing, make elimination of mother to child transmission, make it happen. And I want to say 3 important things to this. It go need our men to help support women when they get belle.
Yes.
Make them go facility, make them test for HIV. Just like then they test for different sexually transmitted infection, then go test them for their blood. Make sure they say they get enough blood. Every time they go hospital, then go test them for malaria. Because if pregnant woman get malaria for pregnancy, if it affect the unborn child, make the husband ask the wife, you don't take the test? If the woman don't test, they positive, no be the end of the world. Medicine day where they go give them during the pregnancy, we go make the baby negative. Then when him born that baby, within 72 hours, he get medicine where they can go give the baby. So that even if the virus don't cross through the placenta when then they deliver the baby, it no go affect the baby.
Okay.
The medicine fit destroy the virus. But if then go born the baby, say for village or for community or for place where the woman no go get that medicine, waiting be say the baby go still get the virus.
Yes.
So for elimination of mother to child transmission, Nigeria don't get Ogbonge plan. The coordinator of NASCAP, Dr. Akudo Ikpeazu, now woman, and she dey carry this thing for her head, say we must test every woman wey get belle for Nigeria. We must find the one wey dey positive, and we must treat all of them, including say we must make sure say them babies dey all right. So this is another thing we want to equalize.
Okay. Thank you so much, our sister Christiana. For those of us who are just tuning in, this one World AIDS Day. As I've been talking earlier, every 1st of December, we dedicate time to people where we say they get HIV and also to mourn those. And every moment we they use them, tell them, say, but this one a stigma where we say we no supposed get for our society. And the people where they for studio where would they listen to, now people where come from Family Health International and they don't they educate us. And one thing where they don't talk about where they took me for liver now, mother to child transmission or mother to child elimination. Make we join hands, make we join our heads together. And one thing where we go also do be say, make people they speak out, make people know they put them inside them, because the society where we dey inside, when people notice say this one get this kind of virus, then go they shift away from the person. But make we understand, say, as technology don't become easier for us, like so different things don't they easy, including HIV, no be death sentence. And if you get them, come outside, make you speak. And if you as a mother, you be human, you get belle, in they very, very necessary for the health of that pikin where you want carry into the world. Make you also try go hospital, meet doctor, talk to the doctor so that una go chook head together and know how this pikin no go get that virus where be say you yourself get. And like we talk, this one no be death sentence for anybody. And okay, our sister, I would like make you continue.
Thank you so much, Harirat. Another thing where we must equalize, we dey call them gender inequality. How the HIV they affect more women than they affect men. This is where I just talk so. It go there like say the women don't come na feminism na da. No, gender issue for HIV it get two sides. As it they affect women more, na men they die pass. If you carry 100 women and 100 men will get HIV, it dey likely say 90 to 98 of the women, they will be living very healthy, no sickness, once they are taking their medicines properly. But the men, before you know it, that is, by the time you know they have HIV, they are very sick. And before you start to treat them, some of them have died. So we want to beg the men, make them come out, make them test. Because when you come out, you test. You know, say, if you be woman, you marry. Before your husband go hospital, it means say you don't want die you. And now we go, they come carry them like small children to go to hospital. Now, men, for HIV matter, you don't need to sick before they come carry you go hospital. All men should want to know their status. And when they know their status, they should take their medicines the way the doctors and nurses prescribe them for them. Because this is very important. Because if the head of the family, they're healthy, no sick, no die, if you go fit, continue to support in family well. And like Harirat say, now before HIV be waiting, we go the first stigma. Stigma and another thing where we go equalize. Now the second thing where I want to talk with that. And especially two areas of stigmatization. The one where they call self-stigma and the one where healthcare workers they do. Those two stigmas, we must stop them. What is self-stigmatization? Oh, you don't get HIV. You can't feel bad. You can't feel sick. You can't feel shame. It can't lead to mental health problem. You no go even want make people know. You no go want go hospital. This one then they call it self-stigma. And I want to really thank one organization where they this country, where they work hard to stop self-stigmatization. That organization, now the network of people where they live with HIV/AIDS in Nigeria. In leader, now Abdul Kadir. Abdul Kadir and his team, they work well through what we call support groups. Where be say for different hospitals and communities, then don't set up this support group. So if today somebody newly gets HIV, that support group, they go just come around the person, then go help them to understand the disease, then go tell them how then to don't process from denial to acceptance, and now that they don't have self-stigma. That work where be say as NEP1 and other organizations, they do them. They help people where they live with HIV/AIDS plenty. The one where I want to talk again, be say health workers, you must stop to the stigmatize people. You must stop to calling them names or being critical of them, or even acting in ways that are not professional. Yesterday, I was on another platform, and the lady was telling me that in a particular hospital in this Abuja, she did one youth couple will be HIV positive, go get medicine. And she they look her phone, why should they wait, make them call her. Now, so the nurse come, they say, you go get where you did there, come. Make you come take your HIV treatment. Say the girl just break down, they cry. We have don't hear different stories about how health workers, through their attitude towards people, and not be saying that because they do them for HIV people, then they do them generally for all people where come hospital where sick.
They call them by the sickness where they come.
They call them by the sickness, or generally then they talk anyhow to them. This is against their human rights. and our healthcare workers must stop it. In fact, government don't do something where they call Bill of Rights, where be say them put them for all hospitals. The right to dignity, the right to confidentiality is there entrenched for this Bill of Rights. If anybody has breached your right to those types of things, you must speak up. And that is why I praise our government, say we get all these structures, but if we don't use the structure, if we don't demand our rights, then go take them from us. But now beg, I even want to use this opportunity, beg the health workers, because if they do the work very well, there will be no need for stigma. Person will get HIV now, in the equal to person will get diabetes, or will get tuberculosis, any other disease. Now sickness, now disease, and if we treat them, we go. Even if you no go, we go live well with them. And I want to say a very important part of this issue in terms of the messaging we want to pass across. Let all of us equalize human rights. Let's respect the rights of people to their privacy. And it gets another special group. I don't talk about youths. I don't talk about women. I want to talk about children. What we call pediatrics. HIV. Waiting they pay me for this one be say adults, 90% of them will get HIV. We don't find them. We don't put them on treatment. Now only 36% of babies will get HIV we they find. Why? Because when their mother born them, then go they hide. They no go want carry the children come hospital. All the treatment where the baby is supposed to be entitled, then they go from one healing house to the other. Yes. Then go they do, and the babies can't get HIV, and you know they correct. So we as human beings, as mothers and fathers, we must want this to change. We must look after our babies. This not looking after babies, it's not because of HIV. It's because generally as a people, we are not paying attention to the looking after of children. When you also consider the 16 days of activism that is happening, these small children will be raped. We must look after our children. We must really care and love for them. And so I want to appeal to all mothers, protect. And we know that as African mothers, we feel give our life for our children. Why, if we can't get HIV, we no want to protect these children? I never understand that. So for pediatrics HIV, they beg us, make we pay attention. That one, they make us no get good name for all over the world. Say Nigeria be one of the countries where pediatric HIV, where they too low. Thank you, Harriet. Okay, make I stop small, give you a chance to ask me a question.
Thank you. Okay, this one now, where would they talk about? We talk about equalizing. May everybody equalize to end AIDS. But what will be the current situation of distribution of HIV services for our country now?
The distribution don't dey big. And I won't give credit again to all those donor and implementing partners we support Nigeria. Make I give you small data. For 2017, we did for around 3,000 facilities all over Nigeria. I assure you now that we are in over 20,000 facilities.
Wow.
For this elimination of mother-to-child transmission, where I don't tell you, say NASCAP, under Dr. Akudo Ikpeazu, they work on. We did for fewer PHC facilities. She get the vision, say, we go take services to like 40,000 more primary healthcare centers in the next 1 year. So that for those primary healthcare centers, any woman will come for ANC, she must get HIV services as a part of the comprehensive package of services.
Yeah.
The directory for all these services, and I no go fit highlight them. But make I just tell you, say, NACA, as part of their coordination effort, don't set up a toll-free number, which allows you to call that number and you will speak to somebody online who will refer you to a service that is closest to you. This work, when NACA do, na big work. Because through that online means, we dey refer many people who no know where them for go for services. And I want...
And they even shame to come outside and make people see their faces.
Yes, so I go talk about another thing. I think say tomorrow na the date for that one, HIV self-testing. So make I no go deep into that one today.
Okay.
Because tomorrow I think say for this same station, we go come talk about self-testing. How you fit sit down for your house, test yourself and find services. But let me quickly give you the NACA toll-free line. I don't think say I don't introduce NACA. NACA being the National Agency for the Control of AIDS. Now government set up this parastatal, say make it they coordinate everything HIV. The Director General, now Dr. Gambo Aliyu, and the number where you go call, where be say NACA volunteer go pick, now 6222. 6222.
6222.
When you call this number, somebody is always there 24/7. Then they do like shift work. As this person did there for 3 or 4 hours, another person go come. When you call, you go tell them, ask any question related to HIV, then go answer your question. Most importantly, if you want to know where you can get confidential service, and based on this, I want to talk about one of the things they call it one-stop shop. This one day for key populations. That is, people will be say by virtue of how they be or then they do, they know they accept them very well for government or other facilities. If they go to this one-stop shop, OSS, then go get personalized private service. So if you call this number 6222, then go refer you to one OSS near you. So the government don't do work. They don't look for public services, and they even investigate private services, including using the social media to do some of the work. Yes. And you know, say for young persons, social media now where then they live. And so because young people, they live for social media, they try to reach them there. So if you call this number, then go even link you with other social media groups where you can interact, meet people of like minds, and get your appropriate service. Over to you, Harry.
Okay, thank you so much, Mrs. Christiana, for this one where you don't talk. And you don't talk about the current situation of distribution of HIV services for we country. Now, we don't talk about youth, and you don't talk about, say, social media and one platform where we say they take reach them effectively. Now, we know, say, many people still there for rural communities where we say them they get this stigma, and most of them know to get this education on this virus. Now, waiting this organization they do to make sure say they educated and to tell them say this one now something where we say all of them supposed join hands together to come out, both the fathers, both the mothers, both those children, those rural communities, those villages, those places where we say sometimes, okay, like this program now, this station now, and they reach everybody, both the elites and even those where they for grassroots. But those villages, how this organization, they work to ensure, say, this message reach them.
Thank you so much. I don't talk about the government facilities, even private facilities. Make I tell you, say, we get what they call community system strengthening strategies. For these community system strategies, we define communities. For instance, we define community in the geographical sense. Say, make we take Nigeria, for instance, we get about 744 local governments.
Yes.
So for each local government, we get between 10 to 15 wards. We they work like that in many states. We be say through the ward the health development organization, because each ward they get like committee where they in charge of health. We go to them, we go train them, we go give them messages, then go use their own local language, talk to them people. Make I tell you that PMTCTC through them, when they don't understand, say good where pregnant woman no get test for HIV. Now then go gather the women, say you go come to our community, the women go gather, then go test them. So we get what they call community strategies, where the message, even on radio, go before your local language. When they come to physically see you, We get what we they call community outreach teams. These community outreach teams, they will move from one community to the other. I know that recently I was in Anambra State. The Commissioner for Health don't write the letter. They go carry the letter, go to the head of the community, and the head of the community go work with the community outreach teams to make sure that in community get access to testing, to prevention messages, and to referral for treatment.
Okay. I go still many people go just they tune in at this moment, and some of them go they wonder waiting they happen. For those of us where they always follow international events, you go know say every 1st December na day where we say they set aside for World AIDS Day. And the theme that is the matter where we say this year on one focus on now equalizing, that's equalize now be the topic where we say this World AIDS Day this year go focus on. And now this one a call to action for everybody. And they tell everybody say make we work, make we put practical action to ensure say we address the inequalities where they among people where we say them get this HIV virus. And some of these things include make we they increase the availability and then the quality and supply of services for HIV treatment, testing, prevention, so that everybody will get access to these things. And we they talk about mothers, we talk about fathers, we talk about children, we they even talk about babies where we say them never even born. And also to make sure say the laws, the policies and practices where go work against the stigma and exclusion where some people they face, that is people where they live with HIV and marginalized populations go get, so that everybody will get this virus, they welcomed into society. And yes, now Christiana Ekaite Lanian, I hope so I get the name correctly. Now she done the educate us about this. And the organization where also they for studio now Family Health International. And this organization now organization where we say in the work towards ensuring say the organization are Family Health International, and now them they for studio to educate us about this World AIDS Day. All right, our sister, I would like make you continue with this topic.
Okay, as I did tell you so, say Nigeria don't try. The amount of money we don't go into this matter in the last 30 years, they plenty. But we they see say the people where they help us, they don't they tire. And one day, then go say they no do again. How we go take, sustain,
and finance this program so that people will, and I forget tell you say the old services now free. The HIV services, it is free. When you go to facility, whether public or OSS, is free. You no go pay for them. Now the government of Nigeria, PEPFAR, Global Fund, and other partners they pay for them. But we want make state government join and put. We want make local government join and put. We want make federal government get money put. The federal government don't set up an HIV trust fund for this matter. But when we set up this trust fund, we must put the money and we must be thinking when the donor leaves. Right now, Nigeria, they participate, but I can say that their participation is around 10 to 20%. But all donors are trying to say, this load, now your load, we don't help you carry them over 20 years. Instead of 10 to 20%, increase them to 30 to 50%. So we won't beg our government, all those where they're responsible for financial appropriation, for National Assembly, National Planning Commission, National Ministry of Finance, make them look into the matter. They support NACADG to finance and fund HIV/AIDS program more. But as I tell you before, the one where they do, make we say they don't do them well. But it still gets something where I want to talk. And that thing we say then public facilities, they charge waiting with they call user fees. Many states, you know, fit enter hospital like this without buying card. And as you buy card, you could pay consultation fee. No be say the money plenty too much. Sometimes now 500, sometimes now 1,000, sometimes now 2,000 naira.
but many of the poor people, that is one inequality, poverty, they no get that money. And I want to say that about 12 government states in Nigeria, they don't remove this user fee for HIV services. But waiting for they better be say, make the whole states, make them remove this user fee. So that the people where we never reach, where they poor, then go fit get access. Remember, say equality of access, it is like one of the things where we need to create, where we go equalize. So we want to appeal to state government, say, make them look into the issue of user fee. We don't advocate for this issue. And as we advocate some state government, when they don't become persuaded, say, not true, government don't bring us support. All they're asking from us is this little one. Waive it. So they will waive it. And we will work with the facilities to make sure that these monies are not being collected. So we need to equalize that. Remove all user fees for HIV/AIDS program. It did like say then go waiting then they call laboratory. All the laboratory tests what they do now free, but they feel reach some laboratory then go still want to charge them something. All these hidden charges they discourage the people who get HIV to access services. So I want to appeal on that score. Say make we look into that. Thank you.
Okay, thank you so much for that. This one means say may everybody come out together so that finances go there available for those people where we say that they live with this stigma. Okay, this one is still Human Rights Radio 101.1 FM, and today now World AIDS Day. And the people ready for studio now Family Health International, and this Family Health International a non-profit organization where we say them they operate from more than 17 countries, and then their work for Nigeria they based on human development challenges, and they also try to combat HIV/AIDS. They try to ensure say they strengthen healthcare delivery systems, provide health, water, sanitation, and different things. And part of their mandate today now to ensure say this stigma, this AIDS, this HIV go be something where we say Nigerians go they aware of, and also the stigma go they reduce, and then they join hands with government. And they also come out to talk say this one now something where we say everybody for the country suppose put hands together, suppose put heads together, because now something where we say in the border on everybody. And when you been they give the example, you be mention some African countries where we say them don't even they ahead of the country because of the fact say we still they back. All right, I go still like you make you talk about this. I'll still like you make you add matter to this. How waiting.
Well, we're still on Human Rights Radio, and we are celebrating the World AIDS Day. We are celebrating Nigeria's achievement in having tested 90% of those who are living with HIV/AIDS who now know their status. And of those 90% who know their status, we have been able to link about 98% to treatment. This is a very great achievement for Nigeria. We have also reached the 95% viral load suppression rates for the people who are living with HIV/AIDS. But I'd like to talk about one idea where we they call U is equals to U, meaning undetectable is equals to untransmissible. This not the final goal post for everything where we they do. What I mean by say this not the final goal post. If person get HIV, the virus they in body, the medicine where then they give them, the purpose of the medicine be say make it lower the virus for in body. As the medicine lower the virus for that person body, it go get the stage where we say, if they do test for the person, then if you detect the HIV, because the HIV don't small in terms of in volume for that person's body. So some people go say they don't get cured. No, it is undetectable. But then once you reach that stage that the virus is undetectable in your blood, it means that you cannot infect someone. So it is important that if you have been identified as a person who is living with HIV, you do the following. Number one, you take your drugs as at when due. You go to meet the doctors on your appointment days. The purpose of seeing your doctor is that your doctors will review you. You will do your viral load test so that they will determine whether you are virally suppressed. One good thing with this viral load suppression and the test be say, once they test you and you have been virally suppressed over a long time, then no go they want to see you for hospital every time. Instead of asking you to come maybe once in 2 weeks or once in a month, we get waiting then they call multi-month dispensing of drugs. Then if we give you 3 months of drugs, it get people where we do give 6 months of drugs because the test don't show say they don't they stable. And these people, if they meet with another person, the likelihood of that person getting HIV is very low. And even amongst persons living with HIV, they have married each other based on this understanding, and they have not passed on the virus to their unborn babies. Why? Because the virus in them is undetectable. 2, because they have ensured that their babies receive the right treatment from pregnancy to when they are newly born and on an ongoing basis. One of the things that they give me joy for this work, where I don't do like for nearly 30 years, be say, I they meet people and then go say, ma, thank you for the work that they do. Are they positive? My wife no they positive, but we get picking where they negative. Are they positive? My wife they positive, but we don't get 2, 3 children and they are negative. We they happy for this turn of event because we know say there's future for us. Our children will outlive us. But I want to talk about something that is also that we are also seeing, that as the people who have been taking this drug are growing older, because this is a campaign that is being led by my sister, the leader of THU.1. As people are growing older, taking these drugs, they are starting to observe certain side effects in terms of certain chronic ailments that they may have. We are providing spaces for this. We are also doing a monitoring of these same people for non-communicable diseases like hypertension, high blood pressure, to ensure that they have access to services. So the benefits you get for registering in an HIV programs are many. And so I want to appeal to those of us who are positive, because that is another whole community. When I tell you that it's about 1.9 million that was estimated to be living with HIV, that's the population of some small countries. And so if that community themselves stop stigmatization and support each other, as NEP1 and THU.1 has been promoting, we can really see an end to this epidemic. I think these are important information we want to put there. The community of persons who are living with HIV, their responsibility towards themselves in terms of adhering to their drugs medication schedule, in terms of visiting the facility as at when due, and in terms of knowing their viral load. Because when you know your viral load, you can do something about it if it's too high. But when you don't even know it, the next time we will see you is when you are very sick. And by the time you are very sick and the load of the virus in your body is high, managing it can be very difficult, and some people don't pull through. Thank you very much.
Okay, thank you. One of the reasons why we say this program they come up now to raise awareness for the need for everybody to get tested. So far with the continuous awareness and everything, how the turn up done they like?
I won't say that in the past we just they test everybody indiscriminately, but as the effort they build up, we can't no say we go they do wetin we they call targeted testing. Say we no need make we just they test everybody, because as a prevalence they under 2% of our 200 million population. If we find a way to target the testing so that we test the people who are likely to be at high risk, we will find more cases. That is happening already. That targeted testing is happening already. And that targeted testing is based on what we called the risk stratification tool. So if we are talking to you, whether in the community or we fit there for outside, say national transport workers, they don't allow us come for garage. Before we even test you, we go use that tool. We go ask you a certain number of questions. Based on the questions we ask you, we can determine whether you're a candidate for testing or not.
Okay.
We will also provide you what we call pre-testing counseling. Pre-testing counseling, which is to prepare you for the test. When we finish testing you now and your result comes, we will provide you post-test counseling. If you positive, we go counsel you, say you need to remain positive. And based on what you know of yourself, you will remove yourself from certain risky behaviors. If you are negative, we will counsel you, because the news of the virus to some people can be devastating. And there are certain psychological and physical manifestations that can come. We will not only counsel you, we will ensure that we link you to the appropriate treatments. One place that the money on this program is going on is training and retraining of various cadres of workers, from doctors to nurses to community level workers, so that everybody in the system has the appropriate information to do the work well. So in terms of testing, as I had previously said, the UN goal is to have tested 95% of the estimated number of people living with HIV/AIDS. Nigeria has reached 90%, which is a pass mark, a good mark. But you see that 5%, like Dr. Gambo Aliyu said, is that time when we are about to crest the hill. We need more effort. We need more resources to be able to crest that hill. And so this is why we are saying here, join hands and help us on this last push, so that, because we have set 2030 as when we want to have eliminated HIV in our midst, we will have succeeded. Let me also tell you something that Nigerians should be proud of. You know that when COVID came, there was a lot of anxiety that COVID would be devastating to our country. One of the reasons why COVID was not devastating was that the government of Nigeria has set up structures from the days of Ebola through the days of HIV to ensure that we have the ability to detect those types of things and to control them before they enter into our general population. One thing that I have experienced personally is port health. Nigeria really is doing most amazingly in their port health. If you travel out of Nigeria, you must show the evidence that you don't have COVID. Before you come into Nigeria, you must show evidence that you have received all your vaccination and you are COVID-free. In fact, they don't want any WAYO evidence. You must have tested, you must have uploaded this on an international portal, and you must get a certificate. And that certificate you must upload before you start traveling. So, for instance, if you get to an airline, any airline that comes to Nigeria, they will not board you if you have not uploaded that document.
Okay.
And if they cannot see it by themselves that you have done so, they will not board you. If you get to Nigeria, despite the fact that they checked you where you boarded, Nigeria will still want to say, in case they missed out something, they will check you. This is very good. This was how Ebola did not devastate us. This is how COVID has not been able to devastate us. And so I want us to be proud as Nigerians that our ministers of health, our NACADG, our NASCAP coordinators, and all those people responsible are actually doing their work well in this regard. And we should give kudos to them. But most importantly, as a people, we must support them. We must work with them, because there is no follower. There's no leadership without a good followership. Thank you so much, Harirat. I want to stop here now.
You want to stop here? Okay, see, say earlier you been mentioned, say, attention, did they give plenty attention to healthcare givers? So I want to make you emphasize on that one. How did they strengthen the systems where we say they need to join hands together? Because we know, say, in as much as individuals get their own part to play, healthcare workers still get a bigger role to play. So talk about things like health financing, how now they work on that one, service delivery. You also talk about leadership and governance, and things like health information management. I want to make you emphasize on that one too.
Okay. When we talk about health system strengthening, WHO is the foremost organization that has set out the pillars for health system strengthening. The Yoruba people say, money say, if I know the house, no start making any plan, because your plan no go become implementable. So the first thing where you go take no, say any government get good governance, it be how are they financing the health system. And so financing the health system has been a subject that Nigeria has been engaging with in the recent past. Even though we have a lot of brain drain and the numbers of various cadre of health workers are dwindling, we are still making efforts to do what is called task shifting. That is, we are looking at certain levels of health workers and we are saying, this kind of task, is it not too burdensome for this level? Should we not bring that task to a lower level? So Nigeria has created new cadres like community health extension workers, community health officers, as I also told you, community outreach teams that help to do part of the work that we are wanting health workers to do. So in terms of health financing, our government is doing what they can. But the Abuja declaration was to put 10 to 15% of our budget in health. We have not reached there.
10 to 15%.
10 to 15%. I think the highest we have gone has been around 8%. There a whole number of group of people who are advocating on this. We need to fund our health system adequately. And when I talk about our health system, the HIV system is a subset of our health system when it comes to testing and treatment services. In terms of coordination, the national level coordination under Gambo Aliyu is working very well. But we need state governments because of Nigeria is a complex and huge country. The 36 states are like 36 countries, if you want. And so we need the state governments because health is on what we call the concurrent list, meaning that the federal has its own limitations, the state and the local government. The state and local government, they must also step up in funding health system. In fact, this is where the emphasis should be in the next 5 years. That some state governments, I don't want to mention them, they are getting very close, and we tend to see them as models. Lagos State will be one of them, Nasarawa State, Kaduna State. Let me just stop there so that I will not start a state government fight. That is beyond my pay grade. But they are doing very well in terms of articulating these issues. Another subsystem is what you mentioned, the health management information system. Nigeria, they try for this one well. And even me, I did for part of that system somehow. Nigeria has set up this HMI system up onto what they are calling NDR, National Data Repository, where we say all the data, they go to one place, and through technology, you can look at the data and you can make certain big time decision about where there are problems. Like on my own grant now, in a particular state, every month we will say these 2 local governments or these 3 local governments are not doing well based on data. During this recent flooding problem we had, we were able to quickly know the local governments that flood had ravaged because we're not seeing their data the way we were seeing their data before. So I want to say that we are trying, but we need to fund that system. Right now, it is the donor money and the federal government that are really making it work. The states need to put money into that system for their own state so that they too can have what we call high frequency reporting for their states. Some state governments have started, but we need all the state governments to also be on the same page. I would now like to go to human resources system, which is the one associated with the health workers. Our human resource planning can be better. We are short of a number of cadres, doctors, pharmacists, and nurses, because certain other countries are poaching our trained workforce. Let me tell you that it is a mixed grill in the sense that we are sad to see them go, but they form part of those in the diaspora who are sending a lot of money into this country. So in a way, we should see them as ambassadors rather than mourn their living alone. But what we should do as a country now is to train more people. In the days when I went to university, those in the medical school and in nursing school had scholarships. They were even being paid while they were still studying. So it made the children of poor people to have access to that level of education because their parents could not afford to be maintaining them. They were being maintained by government. But we also need to have a system that ensures that when these people have been trained, that they are bonded and can work for the country, at least for a certain length of time, in order to develop our health workforce. Our health workforce is too urban-based because nobody wants to live in the rural area. If there were better roads, there was light, there's water in the rural areas, I believe that a lot of our health workers who are concentrated in the urban areas can also devolve to those local areas. But these are big spending areas, and government sometimes is constrained because of our current fiscal difficulties in terms of revenue generation and how our dollar is faring in the global market. But then when it comes to what is within our reach to do, which is when we go to a facility, we want to set it up to provide HIV/AIDS services. Through the donor resources, we train all that needs to be trained. We support all that needs to be supported. In fact, through the donor resources, we often will employ staff to complement what government is paying for. And in this way, we are trying to still equalize to ensure that there's enough hands. Because if there are not enough hands, one area like that I know we support a lot is in the laboratories.
That's integrated laboratory
laboratory services. We have what we call the PCR laboratories. We have what we call the secondary level facilities. We have what we call the NISTRIN, the network of service providers who take samples in a referral system from one level of facility to another. And so all of this needs to be funded and to be monitored and evaluated in order to ensure that they are working optimally. Harirat, I hope I've been able to at least mention 4 or 5 of the key pillars of health system strengthening.
Thank you so much, Mrs. Christiana Ekaite, for this one where you educate us. For many of us who know what's happen, we talk about ending inequalities, ending AIDS, and ending pandemic. And this one is the Human Rights Radio 101.1 FM.
If I maintain your chair, my own be say I come to appreciate Madam for all the support. Madam, which day you go get chance come back again? I beg. I beg.
My ordinary president, any day where you get time for us, because you see, as you did work for the ordinary people, and you they help people to get their human rights. We get areas of human rights too, like gender, like other human rights issues that we can talk about that are relevant to your
now the same
organization's
HIV I won't
mission.
make we talk about.
Okay, anytime when you invite us,
I beg.
we
Okay,
go
choose
come.
between tomorrow and the day after tomorrow.
Tomorrow they fine. We still
Tomorrow.
they celebrate World AIDS Day.
Okay.
Eh,
So tomorrow.
yes.
Thank you. Yeah, 10 in the morning. You know, go be in the okay. Tomorrow, for those of una we just meet the program for road. Tomorrow again, exactly 10 o'clock, we go do the same program, and then that tomorrow we go even open telephone line for people from all over the world. May them call in. May they ask Madam Christiana, the woman when we say anything we concern good health, good living, and a successful existence. Now be her major concern. No be only something we concern women alone. No, even something we concern men, because HIV no be only women they catch. They catch both men and women, elderly and young, and even sometimes. If some people know they careful, pikin, innocent pikin where they belly, then they get HIV. With this one where we talk, we go like make we thank Madam Christiana Ekaite Lanian, and what did you get to talk quickly before we sign off quickly?
Okay, this one I could just thank her for this education where she can educate us, because many people don't know about this thing, and many people still they live with that stigma. I will still say, may they tune into Human Rights Radio tomorrow. They will get opportunity to ask questions, and they will get opportunity, yes, to listen again at 10 o'clock
in the morning. On behalf of everybody waiting for studio, including my uncle, when now he can't forgive me because of the misbehavior, the way we misbehaved to her. Please, our apologies. Una waiting.
Thank you.
Before now, getting a good HMO that works perfectly for my staff was a hassle. I decided to try Reliance HMO. I registered all 100 staff in 5 minutes. I have access to 24 hours responsive helpline and an account manager that helps me with whatever I need. My staff loves the access to the gym, spa, dental care, and hospitals. I will recommend Reliance HMO any day.
Visit reliancehmo.com/corporate or call 0700 7354 2623. Reliance HMO. You can rely on us.
1.1 Human Rights Radio. Redefining broadcasting.
It's good to be with you today on The Pensioner, a program prepared to enlighten the military pensioner, next of kin of deceased personnel or deceased pensioner, and the general public on how to go about their pension